Hi, my name is Gunilla Lundmark and I'm the CEO of Pharmanest. Pharmanest is a women's health company within Karolinska Development, and Karolinska Development is also the majority owner of the company. Today we're going to talk about Shakt, and it's a new pain relief formulation we have developed within Pharmanest. Every year, millions of women experience pain during gynecological procedures. And within Pharmanest, we have started to investigate two different types of procedures. We have started to look into IUD insertions. And for your information, IUD is a spiral in Swedish. And as you know, it's a very common procedure. It's a safe contraceptive, and it has very low side effects. The other indications we have been looking into is hysteroscopies. And if you're a woman and you have problems with bleedings, for example, you can go to the doctor and doctor will go into the uterus with a camera and look at the mucosa. You can take a sample if needed. So it's what we could call is a see and treat procedure. What's really interesting with this procedure is that it's moving out from the inpatient setting. You don't need to keep the patient asleep. You move it out to the outpatient setting. So that was really interesting with this procedure. So the question you will ask yourself is, are these procedures painful or not? Yes, if you look at the IUD insertions, you have 90% of the women experience pain during IUD insertion. And yes, some women, they don't feel anything, but some women, they score the pain as the most unbearable pain they ever experienced. So you have the full range of pain. If you look at the hysteroscopies, it's a longer procedure, it's a more painful procedure, and the most common reason for failure is pain. So if you go to the doctor to have an IUD inserted, what will the doctor give you? Yes, you will get an NSAID. Does it work? No, it doesn't. Or you can use a topical pain relief formulation. Does that work? No, it doesn't. Or if you are in the US, you can go for a paracervical block, and that's like a dental block around the cervix, and it's very painful, and it takes about 20 minutes for it to kick in. So what we have done within Pharmanest, we have developed a new short-acting pain relief formulation, and we call it Shakt. It's a highly viscous 4% lidocaine solution. You apply this product on the portio, in the cervix, and in the uterus before you have your procedure, for example, IUD insertion. You apply it with an in-house developed application device we have developed within Pharmanest. And this viscous solution becomes a gel when it comes into the body temperature. So that minimizes the leakage out of the product from the uterus. We have run non-clinical studies, phase 1 study, and most recently a phase 2 study. It was a double-blind placebo-controlled study, and we included 218 patients. And from that study, we can conclude that we have a very good safety profile on this product, and we could also see a significant pain decrease in the Shakt group compared to the placebo group. And you can see our p-value, I think, is very good. And what's also important with the product is that we can say it has a rapid onset, so you don't have the patient or the doctor waiting for the procedure, and you have a duration up to 60 minutes. So now we know we have painful procedures, we don't have any product on the market, we have developed a new type of product here that is working. So if you go to the market, we believe it's a very large market, and you have around 170 million women with IUDs around the world. In Europe and the US, you have around 15 million women with IUDs. And what's really interesting is that you have a substantial growth, and especially in the US. The US market is really interesting, and it's growing rapidly over there. So why is it growing? It's more and more common that you have to use it if you haven't given birth, and you have a lot of side effects. You can read all about it when it comes to the pills. What I believe what will drive this product, the Shakt product, the women will be driving this product. Younger generations, they will not accept to have pain. Why should I go to the gynecologist and experience pain? And what we could see in our study too, that it was an extreme power word of mouth. It was spread. It was very easy to recruit patients within the study. Then if you go to hysteroscopies, it's very easy to calculate the savings. If you go from a patient asleep in an inpatient setting up to a patient in an outpatient setting, it's more like a lunchtime procedure. This savings of 88% is an example from the US if you compare outpatient settings with inpatient settings. And in the UK, they actively reimburse doctors. They get more paid if they do it in outpatient setting. Currently, there are around 1.6 million hysteroscopies conducted in an outpatient setting, and the interesting thing is the growth. So what we have done within Pharmanest, we have invested heavily in market research. And I think that has been a very, very important investment for us. We have during the years interviewed more than 100 doctors. We have interviewed 1,250 women. We have interviewed payers. It's important to get a confirmation that there really is a need and that your product is a good fit for the clinician. So to summarize, they all agree pain is an issue. There is an unmet need. There is no product on the market that is good enough. And they all rated the SHAC profile very, very high. And it was also well received by payers. And as we all know, it's important to be able to get reimbursement. So that has been discussed too. So this is our pipeline. And what's important on this slide is that SHACT is a mucosal pain relief product. It's developed for the mucosa. So it could potentially work well wherever you have a mucosa. So it's not an IUD product. So, but we've started within Pharmanest to explore IUD insertion and hysteroscopies, but you have a full range of other indications that could be possible. In Europe, we believe that we can file on our existing data. In the US, we are planning to do a phase 3 trial. We have been discussing this with the US authority, and we are planning to go there again and discuss it. So you can see that we have a very short time to market for this formulation. For hysteroscopy, we have recently conducted a feasibility study. It was more like a technical evaluation that you can have the camera and the product together, and you can still see the mucosa in the uterus. And it was very good results. And then we need to do at least one phase 2 study. So what we offer you today is a new type of lidocaine formulation for pain relief of the mucosa. It's a product that has a proven effect, shorter duration of up to 60 minutes and a fast onset. And what we can see, it's easy and not very costly to add on more indications. And we will have patent protection for SHACT until 2031. So we would like to find an acquirer of the company or a partner to support the registration of Pharmanest and SHACT. Thank you.